considered a small island developing state. The Federation has a population of just over 53,000, a narrow resource base, is reliant on fossil fuel imports, and the economy is dependent on tourism, even though the population is that we see over 1 million tourists per year who we have to support. We also depend, of course, on the natural environment. Therefore, we are extremely vulnerable to biodiversity loss and the impacts of climate change. As a party to the Kyoto Protocol and Paris Agreement on climate change and based on reporting obligations, a recent vulnerability assessment was conducted, which revealed that the Federation is increasingly affected by droughts. And this year we are suffering the worst drought in our history. Heat waves. It has been the hottest year recorded in our history. Cyclonic activity, which are increasing and are extending deeper into the hurricane season. Storm surges and changes in precipitation patterns. In the Federation, the most prevalent climate-related adverse health outcomes include the following: waterborne and foodborne infections, where we have seen increase. Heat-related morbidity. We always thought that we were resilient to the heat because of where we live. However, we are seeing more and more people affected by heat. And especially when I visit some of the elderlies at their home, they now need air conditioning in order to resist the rising temperature. We are seeing an increase in respiratory infections, vector-borne diseases like dengue, with 2 stereotypes currently in circulation, something we are not accustomed to see, but is becoming the norm. And so we are battling dengue at this present moment. It was Manuela Angioni in his New York Times article on October 3rd, 2023, who said, "Climate change is now the biggest single threat to public health." And from my own experience, I do agree. Given current trends of rising air and surface temperatures, rising sea levels, and increasing intensity of cyclonic activities, SIDS will be increasingly vulnerable to impacts of climate change. Therefore, this is a call for the international community to recognize small island developing states as a special group collectively. This is an urgent call to action for the international community to fulfill its commitment to enhance climate change resilience of health systems in SIDS. Our government in St. Kitts and Nevis, and I'm sure across the Caribbean, is committed to building a climate-resilient health system with emphasis on resilient health infrastructure. We are in need of a resilient and small hospital that can withstand any Category 5 hurricanes without disruption in services. As a matter of fact, St. Kitts and Nevis is now investing over $60 million in such a hospital, as the present hospital no longer serves its purpose to resist the climatic changes. Just this past hurricane season, increased rainfall suggests that the hospital cannot withstand anymore. I bring that real example as other countries are also suffering. So an extra $60 million that we would not have had to spend had we not have this issue of climate change. And therefore, the St. Kitts and Nevis and other SIDS in the Caribbean are in need of technical and financial support to periodically assess health system vulnerabilities and adaptation options. Such strategic evaluation has become a standardized best practice. SIDS in the Caribbean and other parts need support in implementing PAHO's Plan of Action for Disease Risk Reduction and the Caribbean Action Plan on Health and Climate Change. The Federation of St. Kitts and Nevis needs coordinated intersectoral action to implement adaptive strategies to protect the health of the people. I would also like to say that we believe in solutions, and we are putting our own solutions forward and investing where we must invest. However, we must also understand that investments and partnerships are necessary in order for us to adapt to the significant climate changes that we are witnessing as small island developing states, especially those in the Caribbean and Pacific. We are at the front line of climate change, a problem we did not create, but we have to pay for. However, as I said yesterday, we are not playing victims in this. We want to be part of the solution, and so we are asking the world for its partnership and not its sympathy. And therefore, I think there is great hope. And I finally say, with all of this, there is hope. And we should all believe that we can do it, but we can only do it together. Let us act now to save ourselves. Thank you very much.
Many, many thanks, Prime Minister. Well, it is my great pleasure now to introduce our next keynote speaker, who needs no introduction, Mr. Bill Gates.
Well, good morning. It's thrilling to have a health-focused event at the COP. It makes a lot of sense because, after all, our work on climate is to improve the human condition. And health, which allows people to thrive, be educated, and fulfill their potential, is the ultimate measure of whether we are reducing inequity. Nobody would be better off in a world with fewer carbon emissions, where we're reducing our interventions to reduce illness, starvation, and death. The reason that climate affects health are multiple. We have vector-borne diseases showing up in places that they never did before. For example, African cities that are at altitudes that mosquitoes didn't thrive at the past. The higher temperatures are changing that. When we have flood events, we see not only do mosquitoes thrive, but we also have diarrheal diseases showing up. And then in a direct sense, particularly for people who farm outdoors, there's the effect of heat stress. The WHO's estimated that over the next 2 decades, climate change will be responsible through these mechanisms for over 5 million deaths. Now, to put that in perspective, we need to remember we've made a lot of progress in global health. The funding for vaccines actually now is at a point where it's saved over 25 million lives. The funding for HIV has saved over 20 million lives. And if we take these next 20 years, just a disease like TB alone will be over 20 million deaths. So as we think about our limited aid budgets, which there are many, many demands on, one of the key things is to understand whether new pledges are additional. Are we preserving the basic health commitments that we've made, for example, in the funding of Gavi and vaccines? I believe that we can do both things. We can stay committed to health and not shift resources away, and deal with this nexus of health and climate. What does that nexus look like? Well, it primarily comes through the effect on the agricultural system. Kids who are not malnourished are far, far less likely to die when they get infected with diarrhea, pneumonia, or malaria. And so it's through crop failure and worse nutrition that we see potentially in some areas a reversal of the incredible progress we've made cutting childhood deaths in half. Now, on the first day of COP, it was fantastic. We had commitments about food systems and agricultural innovation. So having crops that are both more productive and can deal with these temperature increases and getting more information and credit and advice to farmers will be a major offset. So here we see that health, agriculture, and climate are very much tied together. When we think about something like malaria, our goal as a world has to be ambitious there as well. We should want to eradicate malaria. The climate challenge, for example, the floods in Pakistan led to thousands of additional malaria deaths there, just to underscore the need to get going on getting rid of malaria. We have new tools that are at the lab level that decimate mosquito populations. There's a lot of work to be done, which will be led by scientists from all over the world, particularly African scientists, to make sure these are ready to be deployed. But for all of these vector-borne diseases, yellow fever, dengue, malaria, these new innovations give us a chance at a reasonable cost to make progress. And so that dream that even in the face of climate, by investing in these health interventions, not letting that be pushed off to the side, and by doubling down on the CG system, we can make progress. We've had two miracles in development in the past, the Green Revolution and reducing these childhood deaths in half. We can take the lessons from those, add our climate investments, and continue to make progress. Thank you.
Thank you. It's always inspirational. There's a lot of work ahead of us. We've heard this morning a clear call to action from here on the stage and from the world stage. Now we'll be joined by health and finance leaders to share with us how they are fulfilling this promise for a healthy future. So please do now join me on the stage, the Honourable Kumbizi Kandodo Chimpoda, who is the Minister of Health from Malawi. Please come and join me. Dr. Ominia El Omrani, who is a medical doctor and the COP27 Youth Envoy. Hello. Ms. Fatima Yasmin, who is the Vice President of the Asian Development Bank. Please come and join us. Mr. Axel von Trotzenberg, who is Senior Managing Director at the World Bank. And Dr. Nícia Trindade, who is the Minister of Health from Brazil. It's a bit of a quick fire round this, giving you all an opportunity to just, provide the floor, the audience and the wider watching audience, of course, where your position is. Minister Chiponda, it's wonderful to have you. Welcome to the UAE and to such an important event. Your health professionals have reported profound climate impacts on health across the country. This year, for the first time, dozens of your fellow ministers of health from around the world are attending this COP, some 50 ministers of health. What are the solutions and common approaches that you would like to see scaled up through climate action, and what message do you have for the negotiators here at COP28?
Thank you so much. This is such a momentous occasion whereby health, for the first time, is being recognized. So we are honored, and on behalf of my fellow ministers of health, I want to really express our gratitude to the organizers. What we're saying is that we are in a crisis, Unfortunately, this crisis cannot just go away by developing a vaccine or something like that. We are in a crisis. A crisis, if not handled well, is going to erode so many gains which we have had in a number of issues. We are in a crisis which is causing devastation, a crisis which is claiming lives. We have seen cyclones, for example, in Malawi, we had the worst cyclone Freddy this year, which displaced over 2 million Malawians, which caused death, which caused, devastation of health infrastructures as well. So we are saying we are in a crisis which is changing even disease burden, disease patterns. In Malawi, we had the worst cholera outbreak, a cholera outbreak which lasted a whole year, from 2022 up to now. It is still there. It has never happened before. We are in a crisis which is causing vector migration. We are getting mosquitoes which were not there. So we are saying we're in a crisis which is affecting everyone, especially the women, especially the children, and indeed the youth. It is a crisis which we need collective responsibility. We need government, we need civil society groups, we need partners, we need the communities themselves to come in. So we are very grateful that now at least health is being recognized, because health has been negatively impacted by issues of climate change. We are talking of drought. A drought, it means many more people, they will not have food, and that will cause malnutrition. That will end in our hospitals as well. So what we are saying is that we need to build climate resilient health systems which will still provide the services. Because when you have a cyclone, you have victims, you have people injured, they will need to be in a hospital. You have drought, it causes malnutrition, you end up in a hospital. There are so many things happening. We have a number of skin cancers which were not there. They need our services as well. So we are saying, let's build a climate resilient health systems. We require infrastructure. We require healthcare workers as well. We require health systems which will be responsive. So it should be at multiple levels. We have to address what has already gone wrong before we even talking about preparing for the future. So we need to invest a lot. We need new money in the health sector. We have been recycling, we have been repurposing. Some of us in Malawi, for example, because of the cholera issue, we had to use the COVID resources to address the cholera. So we are saying we need new funding, we need new investment in the health sector. Investment which will be accessible, investment which will be available, because sometimes you have investment, but it is on paper. It is not readily available. We need investment which will be readily available. So this is the message, this is our plea, this is what we want to call upon our partners. And I'm so happy that we have got so many partners with us this morning.
Minister, thank you very much indeed. Very, very well put. Dr. Omnia, your career bridges two of the most passionate constituencies for climate action, that being youth and health, of course. What impacts are you seeing climate have on youth and the patients that you serve? And what solutions would allow us to better address those impacts?
Yes, thank you so much for the amazing opportunity to be part of the first ever Health Day. In my professional training, I learned that half of the world's children and young people, more than 1 billion, are living at extremely high risk of climate-related disasters. More than 98% of children in Africa, where I am from, are experiencing this, threatening their health, education, security, and at the same time combined with poor access to essential services such as water, sanitation, and healthcare services. As a physician, I saw children presenting every day with asthma exacerbations, acute lung infections that no longer respond to antibiotics. I saw women experiencing heat-related maternal complications affecting even the unborn. Adolescents presenting with malnutrition and nutritional deficiencies because of prolonged drought and crop failure. What I saw as the youth envoy was how young people felt and the shouldering burden of climate inaction and the rising levels of fossil fuel-driven air pollution. And we know that in the last 3 years alone, fossil fuel subsidies, according to the IMF, has increased from 5 to 7%, reaching $7 trillion US. And young people feel overwhelmed and burnout due to the crushing uncertainty of inheriting a future that we did not create. Another study shows that this year, in the first month of 2023, the search queries around climate anxiety increased 27 times compared to the same period in 2017. And when we talk about mental health and climate change, we cannot forget the farmers who are committing suicide because of crop failure, people who are living with mental health conditions that are 3 times more likely to die during a heat wave, but also women and young girls who are experiencing increased gender-based violence because of the scarcity of resources. Yet underneath that fear and that anxiety, there is a hunger for healing and for health-centered climate solutions. And I say that because when I think of solutions, I think of young healthcare professionals and our capacities to drive 3 main shifts. The first one is to rethink our education and our curriculum to integrate climate change as a core component in order to enable us as the first-line responders to respond, detect, and treat climate-related health impacts. But that's not the case right now in 85% of healthcare curriculums where climate change is still missing. The second shift is around the transformation of our healthcare facilities, our own workplaces, towards being energy efficient, environmentally friendly, and climate resilient. And the last shift is calling for investments in the provision of mental health care services, particularly during climate-related disasters. And if I were to make the case for it, if we do that, we can reduce the costs from mental health impacts that are driven by environmental and climate-related impacts that can reach up to $47 billion US annually by 2030. And this can grow exponentially to $537 billion US by 2050. I have seen personally how policies, financial levers, and technology can be leveraged solely to protect health. And this is why, for me, it means keeping social justice and health equity at the heart of climate action, together with many of the young people here in the room today. And this is why, in my view, it is so critical for us to reorient institutional structures, ministries of health, as well as global institutions, to include young experts as equal partners, as co-leaders and co-designers. And this is important because it will ensure that the most cost-effective and practical solutions are also responding to the needs of the most marginalized communities who we work naturally at the front line with them.
Wonderful. Dr. Omnia, thank you very much indeed. Vice President Yasmin, we've heard from our first speakers about the work that countries and health leaders are undertaking, and those issues that have been pinpointed as so crucial to address the climate burden on healthcare. Tell us about the ADB's approach. How will ADB advance the health response to climate change in the coming year?
Thank you very much for the opportunity of speaking in this very historic day of health during COP28. You know that ADB is the regional bank, regional development bank, and we are also the climate bank of Asia and the Pacific. And we are very much committed to support health sector in our projects and the activities. Let me share the 3 ways we are supporting. The first, we are working very closely. We are working very closely with the G20 India presidency to establish an innovative new platform, our climate and health initiative. The ADB-led Climate and Health Initiative is the direct outcome of the Delhi Leaders Declaration. We have 6 areas at the intersection of the climate and the health. The areas are generate new knowledge, mobilize new source of financing, build capacity for implementation, spur innovation, forge new partnership, and champion advocacy to accelerate climate action. The second initiative is the Climate and Health Development Bank Forum, which ADB is co-leading with World Bank. The forum will help determine the best buys for climate resilient health system, and the best buys are those projects, initiatives of climate and health which brings better return on investment, improve the climate finance methodology for health sector, and scale up investment. Our own commitment is to have a 15% climate financing in every health project. Third, for the health sector to be climate resilient and decarbonized, we are developing a flagship training program and collaborating with partners to build human resources in health with green skills in line with our health sector strategy 2023 to 2030. To conclude, I reaffirm ADB's commitment to working closely with our partners at this stage and beyond, and particularly we will work closely with our developing member countries in the Asia and the Pacific.
Wonderful. Thank you so much. Thank you. Mr. van Jotsenberg, the World Bank is the leading global climate financier and one of the leading global health financiers. How is the bank taking on these sort of connected, intertwined challenges and evolving finance to respond to the dual climate and health crisis?
I hope this work.
Yep.
I think that it is overdue that we have today's discussion about climate change and health. And that is very positive. The also positive development was, and also overdue, that was in September, that there was the very first climate summit in Africa. That is, in my mind, 30 years overdue after Rio. And these are two aspects badly ignored. And the worst part is that it is particularly the vulnerable countries, the poorer countries, that are disproportionately affected. And Dr. Tedros just pointed that out, what kind of diseases are coming back or are increasing in countries where they didn't exist anymore, like dengue and so, and also the Prime Minister of St. Kitts just mentioned that. So basically, we see that climate change is making people sick, it's killing people, and what hasn't mentioned, it is throwing more and more people back into poverty. What we are estimating is that climate-related causes could see extreme poverty increase by 44 million people by 2030. And that's the drama, where we have had actually progress made on reducing extreme poverty, that we see now a brutal reversal. And that has been already made worse because of COVID, but now we have additional factors contributing to this. So what we need to do is to think precisely how you link this climate change with development and health. And that's the reason the bank would like to launch a new climate and health program. And it has three components, if you wish. First, knowledge and data. Second, scaling up investment. And then third, partnerships. On knowledge and data, it is extremely important that we actually analyze well the vulnerabilities, making the diagnostics, as well as laying out the options, what can be done, so it can inform more effective investment in the health area. And that needs to be done we are in the bank dedicated a lot of resources on the knowledge agenda here. Secondly, about financing, because you want to scale up investment in climate resilient health investments. And that needs to be scaled up. The bank actually has been increasing enormously our investment since 2020. Just to give you, say, only in the health area, it was about $28 billion, $7 billion on average. And in total, in the last for about $2.2 billion in specifically health-related components on this. Clearly, that has to increase. We have been increasing, if you had compared before the COVID time, actually we have tripled these investments in climate-related health today. But clearly it needs to be done more. You may have heard that Ajay Banga, the president of the bank, said we need to go to the next stage. We are around 40% in total financing of what the bank wants to do in climate. We want to go next fiscal year to 45%. And that will also be reflected in increased ambition in the health area. Now, that is very good, but what we need to keep in mind is the bank can do a lot, but in the end of the day, it is only the additionality that counts. Because if we do a bit more and somebody does less, who is kidding who? What we need to do is to test that domestic investment have to go up and then the international investment, including of the multilateral development banks. We're working with the Asian development, with the other banks together. So what matters is then ultimately how these partnerships are working out. I think that is where we have had a complete new operational partnerships, for example, with the WHO, particularly in pandemic relief, and that is, I say, that's the way to go. So basically what we need to do with financing with the other banks, but also other interested groups, and push that envelope. Because the test is, how can you constrain the fact that basically extreme poverty is increasing, and that is devastating for any development institution. Ultimately, we are sitting here in front of failure. And if we want to avoid that failure, we have to invest, we have to unite, and to act now.
Thank you, sir. We applaud the ambition. Absolutely. Minister Nisia, the floor is yours. Brazil has been a long-time global public health leader, and Brazil will soon be in the unique position, of course, of steering the G20 presidency in 2024 and COP30 in 2025. Minister Nisia, could you tell us about your plans to advance this climate and health agenda and confirm that in 2025 you will very specifically ensure that health and climate are at the heart of those talks?
Well, first, thank you very much for the invitation. As Minister of Health of Brazil and part of global health community, I feel a very deep feeling of hope, and I hope that you can work together with so many partners to go ahead in this agenda. Today is not a single day, but a process. And I think that is very important for us. Thank you very much. In terms of the Brazil agenda, and the first point is that climate change does not affect everyone equally. So this kind of perspective to look for justice in terms of the agenda of climate change and health, we will orient our work in G20 and COP30. We think that it's time to put together these themes and to address the fundamental issues that lie behind the climate health nexus. It's a fundamental challenge to implement sustainable development goals, to whose achievement we remain really committed in our country. It's important to mention that our focus in the agenda for G20 is part of a strategy presented yesterday by President Lula here in COP, that is to work in the mitigation and adaptation plan, and for health is so fundamental as we can see, but at the same time to work for the transformation and to think about the plan for ecological transition. As the Dr. Tedros mentioned and many Ministers of Health here, climate change contributes to the proliferation of disease-carrying vectors like dengue, Zika, chikungunya, and the increase of resurgence of other water and vector-borne diseases in urban areas. We know this. So the challenge is how to increase demand for healthcare, surveillance, health promotion services. That data and the intelligence activities are fundamental, but at the same time, resilient health systems. So I think that this kind of perspective and goals have to be in the center of the agenda for G20 and COP30. Another point important, I think that collaboration has advanced in our sub-region. I mentioned especially Mercosul Ministers of Health during the Brazilian pro tempore president. We have moved forward the development of an operative plan to implement this strategy on climate health. So I think that this contribution, besides Asian, African, and other European, of course, can be together in our agenda G20. Brazil hopes to contribute in this agenda. Climate health and climate change and health is one of the priorities of the agenda proposed by Brazil, and I hope that you could increase in this perspective, besides resilient health systems, and the equity as a very key component of this agenda. Building resilience and adapting to current and future threats need secure funds, and in this perspective, this session, this panel here, has a very important role. At the national level and at the international level, besides working with the other sectors, it's necessary to wake the power of community engagement at all levels of the decision-making process. I think that no solution can be implemented without guaranteeing the full participation of civil society. And this point will be very concerning in our work in G20 and COP30. Yesterday, we have a meeting with the Brazilian civil society here represented, and I think we have to enlarge this perspective in a global level. The challenge is huge, in my perspective. Future-proof solutions are not a matter of choice, but is a need for survival. So we have to work together as global health community for this reason, for these goals. Thank you very much.
Thank you. I thank you all for keeping to time, because that's also useful. But I hope you all feel that you had adequate time to really, provide some perspective for the audience here and for those watching around the world. I applaud you. Thank you very much, and I will let you go. And as my panelists leave the floor, thank you very much indeed. And before moving on to our next segment, I'd like to turn over to the voice of the healthcare community, who are, of course, at the front lines of the climate health crisis.
The climate change has affected my community.
Des inondations liées à des précipitations comme jamais vues.
It caused damage to infrastructure, the hospital and other households.
During the dry spells where there is no food, even mothers who are breastfeeding do not get enough food in order to get enough milk.
Les cas de malnutrition liés à l'insuffisance alimentaire.
These diseases common malaria, skin infestations, typhoid diseases, and even mental health because people are anxious. I work as a community pharmacist.
De santé publique.
A public health nurse.
Yes, climate change is
It's our role to do what is right.
Lest we forget. Well, for our next conversation today, we're going to pivot to one of the overarching themes of the COP28 presidency's consultations this year, the health co-benefits of mitigation. The causes of climate change, namely the burning of fossil fuels, overwhelmingly overlap with the causes of harmful and fatal air pollution. And we've heard that underscored again and again this morning, as Dr. Maha and Dr. Tedros pointed out in our opening. Mitigation and the just energy transition are perhaps the biggest climate contribution that we can make to human health. So to help us unpack the opportunity and these specific policies, finance and tech to realize that, I'm pleased to invite to the stage two distinguished guests joining us today. Mr. Fatih Birol is the Executive Director of the International Energy Agency. Fatih, please join me on the stage. And Special Presidential Envoy on Climate for the United States, John Kerry. Round of applause, please. Come and join me. The choice is yours. Fatih? There you go. Oh, go, John. There's... Oh, you? Oh, no. Brilliant. Thank you. Fatih, let me start with you as Executive Director of the International Energy Agency. You've made it a focus to accelerate a just energy transition, ensure energy security for all and reach global climate goals. And that is, that's a big portfolio. Tell us why the energy transition is foundational to good health.
Okay, thank you very much. It's a great honor to be together with Secretary Kerry here. So we have seen that the fossil fuels, decades and decades, in fact, we should be honest, they help to lift millions of people out of poverty because fossil fuels make our economies more efficient, our lives more comfortable. As such, they played a positive role in the past. But, and there's a big but here, fossil fuels also create serious health implications. I wanted to mention to you one of them, which is the air pollution, which is a big problem in many emerging countries, especially using coal through particulate matters, a big reason for lung diseases. So it's a major issue, and we the Western world has solved this problem, and it is in my view, a moral responsibility. They support the developing countries to solve this problem as well, because it is a very easy, technically very easy thing to solve, and from a financial point of view, not a big problem at all. So we have all the clean energy options today at our disposal, ready and cost-effective in the entire world. We just need this to happen in the emerging and developing world.
Thank you, Fatih. Secretary Kerry, you've been a long-time advocate of 1.5 degrees and a much greater climate ambition, and you and I have talked about this long and hard. How is human health influencing American and global goals on mitigation, and what have you seen as the most effective ways to make the health case for the energy transition?
Well, I think that the reality, the absolute reality of the fact that our bodies are ecosystems, and the world is an ecosystem, and everything has an impact on everything. If you poison our land, and you poison our water, and you poison our air, you poison our bodies. It's astonishing to me that it has taken as long as it has to have health be centerpiece part of the climate discussion. Because the reality is that it's killing people around the planet. 8 million people a year die of bad air quality. And not bad air quality, methane and coal pollution. There's a study that just came out the other day. My daughter, Vanessa, who has the privilege of working with Dr. Tedros, repeats to me frequently that we should not measure progress on the climate crisis just by the degrees averted, but by the lives saved. And the fact is that there's a new study by George Mason and by the Chan School at Harvard, which underscores that coal is in fact doubles the number of deaths over the other sources of air-carried pollution. And coal is about PM 2.5. When you measure the PM 2.5, it's double for coal. Now, we don't need that necessarily to tell us we ought to be transitioning out of coal. There shouldn't be any more coal-fired power plants permitted anywhere in the world. That's how you can do something for health. And the reality is that we're not doing it. So, you know, the measure here is really sounding the alarm bell. I find myself getting more and more militant because I do not understand how adults who are in position of responsibility can be avoiding responsibility for taking away those things that are killing people on a daily basis. And the reality is that the climate crisis and the health crisis are one and the same, totally connected, totally converging at this moment in time. So in the United States, during the summer, the largest cause of children being hospitalized to the cost of about $55 billion a year minimum is environmentally induced asthma. That's the quality of air. And so how do we change it? We start doing the real estate. We want to save lives, and if we want to have healthcare systems that are not overburdened with people who have a new cancer or a disease, which we thought we'd eradicated. You heard Bill Gates earlier and a couple of speakers. We are seeing climate crisis bring back malaria because it's warmer and more moist in certain places. That moisture is also contributing to the increased power of our storms that do damage in our communities, to the increased level of rain, which is flooding people. 30 million people in Pakistan moved in one event. So I think it is very clear, you know, the Hippocratic oath for doctors is do no harm. And we're doing the most harm we could do to the very patients that we then turn to the doctors and ask them to cure. That's the definition of insanity. So we need to get our jobs going, doing the mitigation we need to do. We have sources of energy that are clean. They may, some of them, be temporary, but they're clean. And they are certainly better than opening up a new, you know, the dirtiest fuel in the world is coal. and we should stop killing ourselves using that coal, and that would do more to help health and change the flow of the carbon crisis. It would join us together on a similar path and be one of the most salutary things we could do, Becky.
Oh, thank you. And thank you both. I'm going to let you go. I'm going to carry on with the panelists today, the further panelists I have. But Fatih, please, we do have a minute.
Just one point. When we talk about the energy and the health, there is one issue, which is the fact that, especially in Africa, 4 out of 5 families use primitive cook stoves for cooking a meal, especially women. And the indoor pollution as a result of using wood, agriculture waste, animal waste, is one of the 2 major reasons for premature death for women in Africa. We need to fix this problem. It is only $4 billion per year, and it is a very small money when you compare what we are doing. And the International Energy Agency, Mr. Secretary, is organizing a major international conference next year in Paris in order to find a solution for once and forever to solve this problem, to address this problem.
Thank you. And Vanessa's words are ringing through my head now. I think those are sage and wise words when we begin to pivot into
She's
reminding
very
us.
sorry not to be here. She was supposed to be here, but she had surgery on her knee.
Right. Well, we bless her, and she's been introduced, but just through her wise words. Thank you. Thank you both. Well, delivering on climate mitigation is the challenge in front of us to also deliver on health, of course. Thank you both for your leadership and vision. Well, to talk with us now about how countries and communities are working towards this health-forward energy transition, and I repeat that, this health-forward energy transition. I'd like to welcome to the stage now our next panelists. Sweta Narayan is a climate campaigner from Healthcare Without Harm. Please come and join me on the stage. Jane Burston is the CEO of the Clean Air Fund. Jane, where are you? Come and join us. Julia Gillard, very familiar face to so many people here in the audience, Chair of Welcome, and the Right Honourable Andrew Mitchell, Minister of State in the UK, Foreign, Commonwealth and Development Office. Right. All right, come and sit down. And I've introduced you this way, and I'm going to start at the end and pick up with Andrew Mitchell. And thank you all very much indeed for joining us. Minister Mitchell, tell us about how the UK's leadership on climate change is embedding human health in your approach to climate action.
Thank you very much indeed, Your Highness, Your Excellencies and distinguished guests. I'm very grateful to His Highness and the UAE for bringing us together on this particular subject. And as Dr. Tedros put it so very well, the climate crisis is a health crisis. Indeed, the WHO views it as the biggest health threat facing humanity. Could there be a clearer, more powerful call to arms, as John Kerry so brilliantly put it? Are any of us prepared to see the hard-fought progress we've made on development over the last 5 decades reversed? I saw recently in Mozambique, where I was with the head of the Global Fund, which Britain has added £1 billion to in the last year, the effect of the floods, the growth in mosquito larvae, and the 50% reduction in malaria, which had been achieved in Mozambique, now for the first time for many years reversing. And that is why the UK led a health programme at COP26 along with its partners, and it is why we pioneered the Alliance for Transformative Action on Climate and Health. The Alliance now spans 76 countries, plus many partner agencies, many of whom are here with us today, all supporting each other as we strive towards climate-resilient, low-carbon health systems. And the Declaration on Climate and Health, sponsored by the UAE, powerfully sets out why the international community must come together. The UK signed up to that declaration because it marks an important milestone. We have long been a top donor on global health, spending more than £1 billion each year around the world. And I'm now pleased to announce that new UK funding to tackle the devastating threat that climate change poses to well-being around the world. This includes, firstly, up to £20 million for a new programme to support climate resilient and sustainable health systems, including funding the Alliance for Transformative Action and helping partner countries to mobilise investments. Britain is the first G7 country to have a specific climate health programme of this sort. A further £20 million for a research programme which draws on British expertise and evidence, and in collaboration with our country partners, this will guide our future work spanning climate and health. Increased funding for UNICEF to help deliver climate-resilient water, sanitation and hygiene services in the DRC, Sierra Leone and Pakistan, and to unlock finance. In addition to this, I can announce today that 20% of the £80 million the UK pledged to the Global Financing Facility in October will be spent on climate and health. Our determination to address the devastating impact of climate change on global well-being will not waver. The collective will demonstrated today fills me with hope that together we can make progress. And although I'm extremely sorry I have to depart very shortly for another meeting, my friend and colleague Andrew Stevenson, who is the British Minister of Health, will talk about steps being taken in the UK on this vital area of work. Thank you very much indeed.
Thank you. And with that, you're more than welcome. You've made your apologies, so if you do need to leave the stage, please do.
Thank you very much.
Thank you very much indeed. Super. Good, okay, some decent lines there. Shweta, you work in communities in India where air pollution is a significant cause of mortality, and your organisation, Healthcare Without Harm, is a leading voice, both calling to end the fossil fuel use to protect human health and decarbonise the health sector as a whole. And I think we haven't perhaps talked as much about that as we might do today. Why is the energy transition so critical for health and healthcare? And what solutions does the global economy need to take forward to realise these health gains?
Thank you. I would like to start with mentioning that this year has been yet another sobering reminder that the climate crisis is not a distant possibility. It's a present reality. We live it, breathe it, and wrestle with its consequences daily. Our civilization's dependence on fossil fuels drives the climate crisis and therefore is the greatest threat to human health today. Our bodies, communities, and ecosystems bear the scars of a planet pushed to its limits. We're paying the price of our society's addiction to fossil fuels with our health. In 2020, during the pandemic, the total fossil fuel subsidies amounted to almost $6 trillion US, and while the combined spending of all governments on health was $9 trillion. Healthcare professionals around the world are witnessing firsthand the human health impacts of climate crisis. Our nurses, doctors, and frontline health workers are the first responders to this crisis. Now, we cannot adapt our way out of a 2-degree or a 3-degree global temperature increase. So our solutions must focus on prevention and addressing the root cause. And our approach should move beyond treating just the direct health consequences to demanding both political action and accelerated finance for a fossil fuel-free future. And we can only be successful in tackling the climate crisis when we join forces with other sectors in the society and address the root cause. We, as a health sector, can be a powerful catalyst in the just transition. And that's why I'm heartened that last month, health leaders representing more than 46 million health professionals called on the COP28 presidency and the world governments to commit to a rapid, just, and equitable transition away from fossil fuels towards clean, accessible, renewable, healthy energy. And when we are thinking about transitioning to a low-carbon economy, we must ensure that the socially and economically unjust patterns of a fossil fuel economy are ended and not repeated. And health cannot be a mere co-benefit of a just transition. It should be the driving force. Now, let's also remember that healthcare sits at the epicenter of our collective climate trauma. And the uncomfortable truth today is that the health sector itself is contributing to the climate crisis by its own greenhouse gas emissions. Now, many health systems, public and private, around the world are taking action to shift towards low-carbon, climate-resilient, sustainable health systems. In order to align the health sector with the commitments of Paris Agreement, we must accelerate the health sector decarbonization in high emitter countries and invest in low carbon, climate resilient health systems in low emitter countries, with all of health sector reaching net zero by 2050 at the latest. Finally, I think I would say that this is the moment of transformative leadership and bold decisions. And this brand of leadership requires sacrifices, not of people and communities. We need the willingness to forego profits and shifting of societies that treat our people, animal, and planets as expendables to valuing health. I would like to end with the fact that the essence of the Hippocratic Oath of first do no harm is calling upon us to take on this climate crisis in this moment now, because later is too late. So let us not view health as a casualty of climate change, but as its compass, guiding us with just and equitable solutions into a fossil fuel-free world where no one is left behind. Thank you.
Shweta, thank you. Jane, you were nodding enthusiastically and sagely to Shweta's words there. You, of course, lead the Clean Air Fund, whose mission is to tackle global air pollution. What's your perspective on the highest impact climate interventions for health, and how are they most effectively financed?
I think that most people know that air pollution is awful for our health. If they didn't and they've been listening to this panel, then they should now. Dr. Tedros, John Kerry, many of the panelists have mentioned that the statistics that came out at the beginning of this week, that 8 million people now are dying every year from air pollution, and 5 million of those from outdoor air pollution caused by fossil fuels. 500,000 of those deaths are babies and children. And I think it's easy when we hear these statistics to let them wash over us. You know, they're big, big numbers, but you know, we listen to them and then we forget. But the people that don't forget are the families who are absolutely devastated by the quality of life of their loved ones deteriorating and ultimately their death. Families like the family of Ella Kissy Deborah, who's a little girl who lived in London. She died aged 9 from a very severe asthma attack that was brought on by traffic pollution by her house. And she's the first person in the world to have air pollution written as the cause of death on her death certificate. So her mum Rosamond is campaigning so that that doesn't happen to any other families. But unfortunately, outdoor air pollution is on the rise, as are the deaths from it. And if we don't do something, premature deaths from outdoor air pollution are due to more than double by 2050. But there is some good news for our Sunday morning. 3 pieces of good news that I wanted to share with you, in fact. The first one is that action on air pollution is very often action on climate change. And that's because of the 2/3 of air pollution that's caused by fossil fuel burning. So if the causes are the same, the solutions can also be the same. As Shweta mentioned, renewable energy, clean industry, more walking and cycling, electric public transport. Second piece of good news, the benefits from reducing air pollution come really quickly for health and climate. So on the health side, we've seen experiments like natural experiments around the Olympics, for example. In Atlanta in the 90s, some of the transport measures that were undertaken to reduce pollution meant that children with asthma were showing up at clinics 40% less. In Beijing more recently, it was 58% fewer asthma attacks because of the air pollution measures that they took during the Olympics. And that happens almost overnight. On climate change, some pollutants that are bad for our health are also bad for the climate. That's the same thing. So things like black carbon or soot, it has an incredibly high global warming potential. And if you reduce it, because it only lasts in the atmosphere for a few days, it almost immediately disappears. So it can't land on snow and ice, it can't accelerate the melting, causing water security issues and flooding. And the third piece of good news is that in economic terms, action on air pollution will actually save us money. The OECD and the World Bank tell us it'll save us trillions. And so you were asking what do we think should be done about it and what specifically is the Clean Air Fund going to do over the next year. And I wanted to highlight three things. The first is that today we are very pleased to unveil a new commission that we've set up with our partners, the Council on Energy, Environment and Water. It's co-chaired by the Right Honourable Helen Clark, former Prime Minister of New Zealand, and Dr. Soumya Swaminathan, who was the former Chief Scientist at the World Health Organization. And it aims to address the political barriers to committing to and implementing actions on air quality. It'll strengthen the economic case, secure additional financing, scale up solutions, and track progress. Second thing of three is Breathe Cities, a partnership with Bloomberg and C40 Cities and the Clean Air Fund, which is putting $30 million towards 11 cities announced yesterday to support them to reduce their air pollution by 30% by 2030. And together they're going to reduce greenhouse gas emissions by carbon dioxide equivalent of 280 megatons and save 40,000 lives and 80,000 childhood asthma cases in the next decade. And then thirdly, you mentioned financing. We're very pleased to endorse the climate and health finance principles that came out yesterday. And our own report that we produce every year, State of Air Quality Financing, tells us that just 1% of international aid goes to reducing air pollution. 1%. That's compared to the 8 million deaths. And 2% of international public climate finance. Not only that, and this very small amount of money that's tackling the problem, the funding isn't evenly distributed. So African countries are accessing only 5% of that small number, despite having 5 of the most polluted countries in the world by head of population. So we're looking forward to working with development donors and funders to increase the amount of finance available for air quality and also to ensure it's evenly distributed. And so in conclusion, I'm absolutely delighted that there is a health day at the COP for the first time. I'm very keen to see it continue. And what I would say is it's super encouraging to see that for the first time it's being recognized that these negotiations aren't just about reducing carbon emissions. What is being negotiated here is lives. It's an end to asthma attacks. It's fewer lung cancer cases. It's a better quality of life for all of us. So I would encourage everybody to heed the WHO's call for action that we saw on the screen before. A couple of days ago, 5 million health professionals had signed up. I saw this morning it's on 43 million. Phase out fossil fuels, tackle air pollution, and save lives while saving the planet. Thank you.
Amazing. Jane, thank you very much indeed. Julia, Wellcome is one of the first philanthropic entities with an explicit focus on climate change and health. So from Wellcome's perspective, I might get a real sort of sense of what you guys are up to. What priorities do you see for climate action beyond the health sector to protect human health and well-being? And how will Wellcome advance the work?
Thank you very much for the question. It's a privilege to be on this panel, and any initiative that involves Helen Clark is obviously going to go well. We all should feel a sense of delight, I think, at being at this Climate and Health Day. It is an overdue recognition that climate change is killing millions. It's meaning billions live lives that are lesser than they could have had. and it's a recognition that we need to act and act now. You've heard during the course of this morning about all of the intersections we currently know about between climate and health, so I'm not going to restate them. But to come to Wellcome's role very specifically, Wellcome invests in scientific research, and we are specifically committed to expenditure and research in the area of climate and health. This year alone, we're spending £100 million. And we're doing that because whilst we already know about infectious diseases and extreme heat's effect on biology and the other things that you've heard about this morning, we actually don't have full knowledge yet about the true long-term impacts that climate change, if it continues as it is scheduled to continue at the moment, we don't know all of the implications that will have for human health. So if you think that there is a case for change now, the science that we will be investing in will be building out that case for change even more explicitly. But that doesn't mean that we should be waiting for action. We do know enough now to say that we need to be making the transition from fossil fuels. Obviously, it's got the benefits on air pollution, but it's got the benefits too for climate change mitigation, and that task needs to be addressed. It is an urgent public health intervention. We also know that poor health is a human tragedy, but it's an economic issue. And one of the things I think that dissuades people from acting is maybe they understand the arguments, but when they look at it, there is an upfront cost. And I think we have to acknowledge that is often on the minds of political leaders. But truly analysed with all repercussions, a population that is suffering worse health is a population that is less productive, economies are less strong, and less strong economies are required to bear the burden of increased healthcare costs and increased social care costs. And if we don't understand the intersections of health and economic issues after the COVID pandemic, I really don't know when we're going to understand them. It's manifestly clear. So that too, I think, should reinforce the case for change. Yes, we also know that we need adaptations that we already face. Even if we were able to do all possible mitigation actions tomorrow, climate change is with us now and we need to be adapting to it. And of course, Wellcome believes that as we analyse those adaptations, what we need to do to address climate change, we should have health at the centre of that analysis and scientific and evidence-based research that can guide us on the best possible health choices for the future. But let me end where I began. It is just a delight to be here, but I do hope we leave the room not just celebrating the success of having the first ever Climate and Health Day, but bouncing out of here with new energy and new momentum to make sure that this agenda is at the centre of all future global meetings and all future COPs.
Well said. Well said. Thank you very much indeed. I'll let you go. Thank you. Just before what is our last panel, in fact, and we are close to the end of this full session, but just before we start that last panel, I do just want to remind those who have been involved today that there will be a family photo after this panel, after the video, after this panel, so please stay in the room and we'll take just a few minutes to have that photo taken. All right, before our closing video and our closing remarks, I do want to just welcome onto the stage today. It is my honour, in fact, to welcome to the stage two of these stalwarts of climate and health and in the community. Dr. Jenny Miller is the Executive Director of the Global Health and Climate and Health Alliance. Please come and join me. An alliance of organisations representing millions of health professionals around the world working for climate and health solutions. And Dr. Githniji Gitani is the CEO of Amref Health Africa, the largest Africa-based international health development organisation. A round of applause for both. Thank you. Sit down, please. Come.
You might want to just stand up a little bit.
You can stand up. Doctors, where do we go from here?
Well.
So, Gachinji, we're at Health Day. I mean, I remember a year ago being in a meeting at the last COP where there was a rumor that there might be a health day and we were talking
Hold on. I'm going to stop you there. Can you make sure the microphones are working for these closing remarks, please? Let's try again. Give it a go.
All right, giving it a go. Are we good?
Can you hear them?
Okay, I think this one is working, is it? Is yours working?
Yes.
Yes.
It's all yours. Floor is yours.
Okay. All right, here we go again. Yeah, I'm really excited to be here. A year ago, there was a rumor.
Oh.
Still no mic.
That one.
Sit down with each other. Sit down with each other. There you go. And do the thing, but just make sure you use this microphone because I'm not sure the others are working. Go.
We're at Health Day. It's amazing to be here. It's been a year of work for many, many people. What do you think? Can you believe it?
Well, I can't believe it, Jenny. 27 COPs later, the real face of climate crisis is woken up choking, coughing, feverish. I can't believe how self-destructive humanity is, actually. But we must thank the UAE COP28 presidency that saw the light, planned this day, created a multi-stakeholder steering committee to make this day a success. But I also want to recognize the leadership of the World Health Organization that is represented here by DG Tedros because of the long-term leadership in getting where we are. But all those ministers of health who've raised their voice and put their energy to where we are today to ensure that health is truly brought forward as the real face of the climate change. And special mention to my sister, the Minister of Health from Malawi, who has actually given a lot of leadership on this. But let's thank ourselves too, Jenny, on behalf of all the people who surround us, the people who've been working with us on this journey, including scientists that we represent here, health workers who are represented here, young people like Dr. Omnia and others. I think it's been fantastic to get here. But you've been part of this journey for a long time, Jenny. What does the journey feel like to hear?
You know, just last night I was talking with someone, a colleague that I've known for a long time, who started working on climate change and health 30 years ago. For many, many years, it was a very small community. The thing that's extraordinary is that at this COP, there are literally hundreds of people from the health community at this COP. That's unprecedented. So it's been a long time coming, a long time growing, the movement of the health community that is interested in climate change and working on climate change. And I think for many years, particularly at the COPs, we felt like we were knocking on the doors, sometimes quite literally, like running around and knocking on the doors of different country delegations and bringing the health message and saying, this is important, the climate crisis is a health crisis. This year, it's actually quite amazing to have an official platform for this message for the first time ever. But you've been leading this work across Africa. What has it been like for you to build this work in Africa?
I've seen real convergence of action, actually, passion and social justice rising. I've seen realization by ministers of health, and many of them expressing themselves and saying that actually every climate crisis converges in the health ministry. Every single one of them. When there's flooding, those individuals need care. When there's pneumonia, asthma, those individuals need care. When there are rising cases of cholera, they end up in the Ministry of Health. And therefore, remember also that, unfortunately, some of them die, and the morgues are also part of the health system. So everything we are talking about converges there. But I've seen health ministers rise, and many of them are here, and start to coalesce around a common position. From Kigali, where we had the Africa Health Agenda International Conference, to the World Health Assembly in Geneva, to the Common Africa position that was hosted by the Minister of Health in Malawi, where ministers of health have converged around this agenda, to the Africa Climate Summit in Nairobi, where we hosted this. And every stop of the way, Jenny, the COP28 presidency has been present in all those meetings that I've mentioned. So this is really the moment, and the ministers of health are saying that the conference of parties, the parties in the conference are not necessarily ministers of environment. They are the governments, where the ministers of health are actually equal stakeholders. This is what I'm hearing. So Jenny, the first step is always the hardest. Where do we move on from here?
Yeah, so obviously Health Day, as lovely and extraordinary as it is, can't be the end. It's got to be the beginning. And I think at this COP, it's vitally important that we carry the focus on health all the way into and through the negotiations. I was really struck on the previous panel, I believe it was Jane who said that what we're negotiating is people's lives. And so in the negotiating rooms that where governments are making the decisions, we need to ensure that health is a focus there too. You know, a number of the earlier panelists and speakers have talked about the importance of phasing out fossil fuels and transitioning and really ramping up equitable access to clean energy. That can start with decisions that are taken in the negotiations this COP. And that's I would see that as a really important point to make progress on. How about you? What do you think is where do you think we need to go from here this COP?
I think we need to realize that we have to bring an end to this self-suicide of fossil fuels to begin with. At the same time, we know that what was a threat, a risk of rising temperatures, global warming, extreme weather events is now a reality today. So we must also adapt communities and make health systems resilient, because cholera is rising, malaria is rising. We can't watch that as people die. So we must also strengthen communities through all the things: health systems, food, water, education, and stable homes. And today, we are seeing that there is going to be a lot of engagement with health ministers all alongside this week, and therefore we look forward to a day where this convening is at every COP, but beyond that, the integration of health in the entire climate agenda.
Thank you. Thank you both. And with that, we will close out the session, but that was absolutely inspiring. I mean, honestly, what a way to close what is the first Health Day, and it certainly will not be the last. It's been an absolute pleasure. I hope that this has been valuable. I know the rest of the day will be too, and I know that the determination is there that this is about saving lives. This is not just about numbers. This is not about percentages anymore or temperatures anymore. You know, this is about saving lives, and I think if we take anything away from this, that is so important. Thank you all for joining us. For those who have been panelists and have been involved in today, please stay while we get the family photo. To the rest of you, thank you and enjoy the rest of your day.